Dr. Amish Purohit, what a pleasure to have you here in Las Vegas and talking about health.
Yeah, thank you, Amelia, for having me, and I'm excited to share what we do here at Arkos.
Well, I'd love for our community to know a little bit about your background. Where did you study, and all the good stuff we can learn about you, doctor?
Yeah, so I didn't take the traditional path to medicine. I started my career in the U.S. Air Force as a medical service corps officer, 4.5 years active duty, and then went to medical school. I trained in family medicine and then did a non-operative orthopedic fellowship at the Cleveland Clinic. After that, I practiced for many years as a primary care doctor, consultation on the musculoskeletal aspect for many primary care docs. Then I took over as a medical director for many of the Native American primary care and specialty clinics. And then I was the CEO of their health system. And so Gila River Healthcare in Arizona is there a tribally run healthcare system that owns their own hospital, clinics, two largest dialysis centers in the state, EMS, and certainly is a very needy community in terms of healthcare, because if you're aware of the Pima Indians, those are the Pima Indians. They have the highest incidence of diabetes in the world. And so a very challenging community to ensure that health outcomes improve, because there's a lot of social determinants of health and barriers that these individuals in the community faces. And so that was a very rewarding time in my career to help that community get better health care.
Wow, doctor, now from the military to Arkos Health, tell us about Arkos Health as you're now here in town.
Yeah, so Arkos Health, we are a tech-enabled population health company. We primarily work with payers, health insurance companies, to help them manage their population. So that could be Medicare, that could be Medicaid, that could be the exchange populations. And so we, when you look at our healthcare system, it's very fragmented. And there are a lot of gaps in terms of services for some of our marginalized communities. And what you'll find is that there's people out there that need a little extra hand-holding and navigation of their own healthcare system. And that's basically what we do. We're in 5 states, including Nevada, and we have a large Medicaid population that we work with. And our biggest service to the community is that we are deploying clinical staff into the homes, into the community, to work with these members, these patients, to ensure that we're eliminating any disparities that they may be facing in terms of healthcare, social determinants of health. So if they need transportation, or they have food insecurity or housing insecurity, we will find resources for them, and we will help them to make sure that we take care of those issues first. Because if they're focused on all those other issues that's not their health care, they're never going to get the health care they need or seek the health care they need, because they're too worried about putting food on the table, or too worried about how they're going to get to work, or who's going to take care of their children. And so that is where Arkos excels, is we are there to be a partner for these patients in those communities and really help them. And it doesn't cost the patients anything, because the payers, the health plans, are paying for this. And then we're also helping our providers in the network, our primary care doctors, our specialists, extend their services and helping their patients make sure that, we're all, as a healthcare community, are delivering high quality care to the members and patients that we're serving.
Wow, doctor, it sounds like Arkos Health is going above and beyond, not just health, but also helping with food and everything else surrounding families. That's something beautiful. That's Arkos Health is going above and beyond. That's something beautiful in town.
Yeah, it's a necessity. There are competing factors when it comes to people engaging in their own health care. And our goal is to get rid of those competing factors so they can focus on health. A lot of our patients don't understand that health care should be a priority. If they don't have their health, everything else is useless. if they're always sick, how can they provide for their family if they're not taking preventative measures? Colon cancer is a primary example. Colon cancer is completely detectable in early stages and curable, right? But not when it's in stage 4. And so if you're not getting your colon cancer screening in a timely manner, or cervical cancer screening, or some of these preventive measures like, mammograms and breast cancer screening, these things can be avoided. And so, that's where we're trying to get the message out, is that take ownership of your own health care. But when you are facing challenges in doing that, we will step in and help.
There you go. You heard it from Dr. Purohit and with Arkos Health. So let's take that good advice and enroll and call and sign up with a doctor. And what better with him? He knows what he's doing, and he's here to help our community in town, especially the vulnerable community. Thank you so much, doctor, for being in town.
Thank you, Emily.
Thank you.